Uh, Hi, everybody. I am Dr. Shadow, and I'm here to give you some important information today. So, you're probably wondering why I have a lab coat on. Well, it's because I've been wanting to make an informative video about the COVID-19 situation for a few weeks now. And this video I've been made aware of seems like a good excuse to finally do it. I know this is a bit of a departure from my usual style of video, but you might not know that I have a degree in community health education and a background in public health and healthcare administration. So I have some knowledge pertaining to public health crises, such as the one that we're seeing right now. And it's been really bugging me how much misinformation I've been seeing on social media relating to the virus lately. And I wanted to counter some of that information by responding to this extremely stupid video that I found on the subject. Let's talk about the mysterious MrEnter. Some of you might know him. MrEnter is a YouTuber that I used to watch religiously. I was a big fan of him for a while. He used to give very informative and interesting opinions on both good and bad cartoons, and was generally a pretty decent animation reviewer. I started to lose interest in watching his videos once his opinions started to get a little bit more reactionary. And then I completely unsubscribed when he made this extremely typical tone-deaf video called Everything's Offensive, in which he rages against the evil social justice warriors ruining everything, you know. But MrEnter recently made a video about the COVID pandemic, a video that I not only consider ill-informed and tone-deaf, but extremely dangerous, considering he has more subscribers than I probably will ever see. I'm not going to do a reaction or response to the entire video because I don't want to edit a 3-hour long video. I'm just going to respond to the points that I think are most relevant and most important. But just so that you can be sure that I'm not taking any of what MrEnter says out of context, I'm including a link to the video in the description for you to watch for yourself.
The world is currently going through a global crisis. A pandemic caused by a novel coronavirus has spread around worldwide, infecting at this point over 2 million people, and it has killed more than 100,000 since being discovered in December of 2019. However, through much of the situation, I'm not afraid as many people are. I'm not worried, I'm not anxious. My emotions have been anger and disgust, as people have been desperately clamoring to try and solve a problem that they just can't, throwing whatever they can at the problem, even if it has no chance of actually working.
Oh, I love this argument. The argument basically says, well, there's nothing we can do to completely get rid of the problem, so we might as well just not do anything at all. I've dubbed this argument the lawless argument, because you can literally apply it to any issue that has a legal precedent. Why should we have laws against drunk driving? Drunk people are just going to get behind the wheel anyway. Why should we have laws against child abuse? There's always going to be people that have been abused as children anyway.
It's illegal to use fake IDs.
Yeah, well, it's illegal to rob banks, but people do it.
Yes, people who are bank robbers.
This argument is so stupid because it's basically saying that a perfect world isn't possible. No duh. So let's just not bother trying to change anything. Leave it as the status quo. If everyone had that mindset throughout history, well, we likely wouldn't have anything even resembling a society.
A man in the United States was arrested for paddle boating by himself. That broke social distancing rules. A man in the UK was arrested by being on his own front lawn. People were arrested on a bus for not wearing any masks, in an area where there was no mandate to wear a mask. A man was arrested for playing in an empty park with his daughter.
Yes, there have been instances where authorities have had knee-jerk reactions to people who aren't technically socially distancing, such as people being arrested for not wearing masks. people being handled with unnecessary force by police because they couldn't spread out in a crowded subway, and people getting attacked for being outside. Disregarding the fact that this has overwhelmingly been affecting minorities who already had a problem with unnecessary force by law enforcement before all this started, these are fringe examples. And don't belittle the fact that social distancing has helped lower the spread of infection and has helped hospitals gain better control of the situation. The pandemic is still bad as it is, but social distancing has definitely been helping it not get worse.
This kind of stuff makes me and many others want to say, fuck the public. It's not worth saving.
Whoa, bring it down, dude. Look, I'm not going to act like that I can't be a cynical pessimist sometimes, but wow.
And in these situations, the authorities have basically decided to break their own social distancing protocols to throw them in a jail cell with many other people, which according to the public understanding of the virus is a death sentence. But then again, for the prisoners' benefit, many of them are being let out and back into public temporarily. It's mostly non-violent offenses. The fact that burglaries have risen astronomically has absolutely nothing to do with that whatsoever. It's just looters. And let's ignore the prisoner who was released, now brought up on murder charges. It's an anecdote.
Oh God, he's so close. He's so close to actually making a point. For those who don't know, there was a prison overcrowding problem in America before this outbreak happened. Once the outbreak started, more and more inmates started to get COVID, and it spread like wildfire because they couldn't socially distance due to overcrowding. To try and minimize the spread of the disease, some jails started releasing non-violent offenders early, which just kind of proves the point that a lot of prison reform advocates like me argue that they shouldn't have been in jail in the first place for non-violent offenses. In regards to the burglary thing, there's a number of possible contributing factors to this. Because this is a time of crisis, necessities are selling out and grocery stores can't keep up with demand. There are people that may be getting so desperate for necessities that they can't find in other stores that they're more willing to break into someone's house and steal it from them. Because more people have lost their jobs and aren't earning money, some people may be more willing to steal in order to get money to pay for their rent or other needs and don't have time to wait for the $1,200 government check that may not even be coming in the next few weeks. In times of crisis, we see people doing whatever they can just to survive. It's that simple.
We should also ignore the large rise of firearm purchases that have happened as COVID cases began to skyrocket. We should also ignore people like the governor of Michigan deciding that people can't buy non-essential stuff like home repair equipment, gardening equipment, or things that are clearly stocked right in front of their faces.
Do you really need to buy that sort of stuff right now? What exactly are you going to do with it? And also, do you agree with everything the protesters did in that article that you were showing, such as literally blocking traffic so that ambulances couldn't get into a hospital to the point where doctors had to come out and beg them to let them in? Funny how you neglect to mention that.
People, I have something to say. I work for Sparrow Hospital. How can I do my job if y'all idiots are blocking up the way to get to the hospital? There are people dying every minute. And you guys, Trump supporters, want to block up everything and don't care about nobody else. What if it was your mother? What if it was your father? What if your infant son or daughter gets sick? This is ridiculous. It is unfair for the people that have to go to work every single day, especially in the hospital, to do their job. If y'all don't take y'all asses home, this is what I'm mad about. All y'all want to sit down there and pump your horn, hang out the window, throw your flag out, because y'all don't like what somebody told y'all to do? Y'all some idiots. Total idiots. I can't do my job. I can't help anybody because y'all decide to block up every entranceway
Here's a little fact. Michigan is one of the most highly infected states right now. So it's no surprise that they're resorting to more extreme measures in order to contain the virus. Funny how you don't mention that, almost as if mentioning it would show that there's an actual point to implementing these measures that you're whining about.
The protesters are just angry that they can't go motorboating. But no, the police are right. Protesting is clearly a non-essential activity at one of the biggest governmental authoritarian overreaches in the modern era.
One of the biggest authoritarian overreaches of the modern age. Funny, I don't recall you having this same level of anger when the government started locking up U.S. citizens in ICE detention facilities. I don't recall you crying about the Trump administration removing protections from LGBT people so that employers can fire them more easily. There's been a lot of authoritarianism during this administration. This is not one of them. And yes, as of now, protesting is a non-essential activity. You aren't going to die because you aren't allowed to have mass gatherings where a person infected with the virus that's not showing symptoms could potentially easily spread the virus to everyone at the gathering. Here are some facts about this virus. This virus is extremely contagious, like to an almost cartoonish degree. Literally, someone testing positive for the COVID virus could literally give it to you if you're just in the same room with them, breathing the same air for a few minutes. Someone who's carrying the virus just breathing near you could potentially put you at risk of infection. The virus can live for days on surfaces that haven't been cleaned. And there are people who are carrying the virus who aren't showing any symptoms at all and who don't know that they're carrying it. This is why these excessive measures are being put in place.
We should be grateful here in the United States that our mayors aren't threatening to send in the police with flamethrowers, or China literally welding people into their apartments until they starve to death.
Wow, dude, where'd you hear about those? InfoWars? Next thing you're going to tell me that FEMA is building death camps. It's funny how you don't have any, screenshots of articles or sources to support these outrageous claims that you're making, kind of like the other ones that you had. Almost like you couldn't find any because it's not happening.
If you're not paranoid and hiding under your bed, you deserve to die. You deserve to die in your own fluids, and all your family members do as well.
Hey, I'm not going to say that if you aren't following the guidelines that the trained health professionals are advising you to follow, that you deserve to get infected and possibly die. But I will say, if you do get infected because you decided to disregard what health officials were saying, you have absolutely nobody to blame but yourself.
So let's get into the facts and figures, shall we? A lot of countries and states are beginning to consider opening things back up. And on many of these forums, including the one Reddit is specifically pushing for people to join to get coronavirus news, opening up at any time before a vaccine is good and ready will be the worst idea in history. After all, they say that as soon as the quarantine is lifted, cases will start rising again. Yes, they will. This was always the plan. This is what we signed up for. This was always the intention, and this is what we were told.
No?
The only purpose that they had was to stop hospitals from being overwhelmed. That is it. That is the only intention they ever had. No matter how many cute cartoons Google shows you, or how many times you've heard the slogan, flatten the curve. So it'd be really nice if you guys can stop moving the goalposts. And make no mistake, waiting any longer than when the curve is flattened is moving the goalposts past what was originally intended by this.
Oh my god. Oh, hey everyone, this graph is very misleading. Why? Because MrEnter says so. Okay, but seriously, while this graph isn't the best representation of this, like it doesn't even have any numbers on the X and Y axes, it's still a simple but relatively accurate just depiction of what it's supposed to be illustrating, which is how to prevent hospitals from overflowing and being overwhelmed. You can even find similar graphs on other health websites from previous pandemics in the past that look really similar. You see, the dotted line represents how much the hospitals can take before they start getting overwhelmed. I don't think I should have to explain why hospitals getting overwhelmed would be bad. Like, this isn't that hard a concept to grasp. Hospitals are run by people, not robots. People can get overwhelmed. And when it's a vital service like a hospital, that shouldn't be allowed to happen. And no, that isn't the only intention that they had when implementing these guidelines. That was definitely a big part of it, which is still important, but it was also to prevent more people from getting the virus and spreading it. As I previously said, more information is coming out about this virus showing that it might be even worse than originally theorized and may even cause permanent damage to the body, specifically the lungs, which you need in order to function. And it's not enough to just flatten the curve, as they're saying. Enter, I'm not trying to be mean here, but are you really this dumb? Or are you deliberately missing the point? Because this really isn't that hard a concept to grasp. It's like, I know I went to college for this sort of stuff, so I guess I can more easily grasp it, and I guess I'm coming at this from kind of a point of privilege, but really, it's not that hard. Do you really not realize that if we were to just start opening everything back up and go back to normal right when the curve was flattened, a second wave would just start right where we left off and we'd start all over again? And that's not even counting the fact that we haven't even gotten there yet. There are still multiple places in this country that are still being overwhelmed by the virus. New York and Michigan being two of those states. In places like New York, they're having to increase the amount of bodies they're burying in mass graves. Yes, that's happening. And unlike your flamethrower and welding and apartments claim, I actually have sources to back that up. There is an increase in mass graves in certain parts of the country because of this epidemic, and you want us to just go back to normal and act like nothing is happening?
It did buy us time, which allowed us to discover treatments and better ways to care for people who came down with COVID.
No, it hasn't. We still don't have effective drugs or a vaccine to treat this. And you can still get it again after recovering from it. There are people who have recovered from it and then tested positive again within days of recovering from it. We're only just now possibly discovering a medication to be used to treat it, and it's still in the testing stage. It could still be a while before we have a way to effectively treat this thing.
But to assume that we can stay in lockdown until all this is over is ironically one of the worst and most short-sighted ideas in human history.
Yeah, definitely not as short-sighted as opening everything back up and pretending like everything's normal again.
The most optimistic forecast for a vaccine put the time crunch on 12 to 18 months. That's optimistic. Do you know how long it could take to get a vaccine? A very long time. But we have billions of people at this rate who need them. And getting those hundreds of millions assumed that we stop producing other vaccines, such as influenza or measles, the latter of which is more infectious than COVID-19, by the way. And ironically enough, over 100 million children are at risk of missing out on their measles vaccine due to this pandemic.
Oh my God. Yes. Measles is more infectious than COVID, at least from the info we've gathered on it so far. But measles has been around for longer than COVID has, and we have more preventative measures and treatments for it that we've developed over time than we currently have for COVID.
One of the bigger mistakes in the epidemic, made by the powers that be, was the attempts at trying to downplay things for the sake of preventing fear and panic. And I'm talking everyone here, not just the president.
Yeah, downplaying the virus is terrible, and that's totally not what you're doing right now. Do you even watch these videos before you upload them? Would you pick a position?
The way you can fight it is simple, my friends. Just stay the fuck at home.
I mean, it should be really easy. I don't know what's so hard about this. The rest of us have these huge mansions to explore, and we have enough money so we never have to work again.
But apparently you, a full-time YouTuber who worked from home before all this and earns his income through Patreon, does have the authority to demand that we all end the quarantine and everyone go back to their jobs.
There was a study a few years back. Scientists put people in a room to be alone with their thoughts, and the only thing that they could do to distract themselves was administer themselves with an electric shock. And people, by and large, chose the shock. People would rather experience pain than be alone with their thoughts. It's a good thing that all the sports and movies and entertainment options are canceled, while toys and games are deemed non-essential and can't be purchased.
Oh dear, new entertainment isn't being made? Whatever will people do? I mean, all they have is a bunch of YouTube videos, podcasts, online ebooks, audiobooks, movies, TV show episodes, and music that they might not have discovered yet, just waiting for them to use to entertain themselves.
If you think that an indefinite lockdown can only save lives and will put no one at danger, I'd advise you to start volunteering at a suicide hotline sometime soon.
And if you don't believe that this is an effective way to keep people safe and lower the spread of infection, I advise you to listen to health professionals.
Remember what I said earlier? Gun sales have risen through all of this. Well, calls to suicide hotlines have also risen. Anxiety and depression are going through the roof. And with them, we're going to see a lot of drug and alcohol addiction, and of course, a sharp rise in suicides. And let's not forget some of the other social consequences of this, were the only ways that some kids were able to eat. And on top of that, domestic abuse is slated to also skyrocket because victims are now trapped at home with their abusers. And we're already starting to see a rise in these things.
Wow, these are all terrible things that existed before COVID that are unfortunately being exacerbated as a side effect of the quarantine. So, what are your proposed solutions to these problems? Because they're not going to go away once we go back to being normal. Do you support common sense gun legislation? Do you support universal basic income? What about universal health care, including mental health, which we're about to get to?
Depression is treatable, though. I know that for sure. In-person therapy is perhaps the best thing for it. Too bad in this current situation, it is impossible.
Yes, depression's treatable. I should know. I'm still being treated for it. It sure is great when you can get the help that you need, if you can afford it. Unfortunately, there were and still are plenty of people that couldn't afford to get mental help for their depression before this pandemic started. However, in other countries, they can get mental help, no problem, because they have nationalized health care. Something that we lack.
But there are some treatments you can do on your own time. This is just one of the things that I mean by short-sighted. Just keep in mind that the elderly commit suicide at a larger rate than young people. People 45 and older are much more likely to commit suicide than people who are younger than 45. And that is just one consequence of lockdown. Grandma might not die of COVID, but with her savings all dried up, she might pull the trigger.
And older people are also more at risk of dying from COVID than young people are. You're putting your grandmother at risk of suicide by supporting this lockdown. So you should put her at risk of dying from the virus instead by ending the lockdown. I mean, that's basically what you're saying.
Like, the people who think that the economy is just rich people problems and think that anyone who does want to restart the economy wants Grandpa to die. Well, sorry, Grandpa was 2 years to retirement, and if everything goes belly up, everything he saved for his entire life will be worth nothing.
Yes, and if he dies, he won't be able to use that money either. So what's more important, your money or your life? Enter seems to think money is more important. I disagree.
The economy is not stocks and bonds and the margin of profit that rich people get. I mean, it is that, but it's more than that. The economy is whether or not you have a job, whether or not the stuff you buy is affordable, and whether or not you're able to eat.
So you say the economy is whether or not you have a job or whether or not you can afford the stuff that you need. Again, are you going to support universal basic income, livable minimum wage, affordable necessities, and universal health care so that people don't have to worry about that?
So, it's been stated that for every 1 point rise in unemployment, that's between 37,000 and 40,000 deaths between suicides, homelessness, drug overdoses, and all that good stuff. So that's just 3 points of unemployment, and that's more than the current amount of COVID deaths worldwide so far. If this lockdown goes on too long, you might be looking at a 32% unemployment rate, 1/3 of Americans out of a job, and things like food banks, which are already being strained, running out of resources. If the math all adds up, that's over 1 million deaths. Oh, and that's not all! That includes a substantially worse quality of life for everyone who has survived.
Okay, enter. Look at me for a second. Look at me. And so I'm going to say this really slowly so that even you can understand it through my fursuit head. Okay? Are you listening? Are you listening? The problems that you have been listing throughout this video are not a result of the virus. They are a result of capitalism.
Oh, and believe it or not, it's not really the big rich people and the corporations struggling to get the economy open right now. It's the middle class people who are going to be screwed if it doesn't. The rich people are probably going to be fine no matter what. In fact, a lot of these big corporations are doing really, really well right now because they have no competition from the smaller mom and pop shops. Currently, and this isn't theoretical, this is actual stats and stuff that's actually already happened. 1 in 10 small businesses is not opening again when all of this is over. 6.6 million people right now are trying to get benefits. And that's the people who could access the website here in the United States. Not all of them are getting off of unemployment when all of this is over. The Postal Service is slated to be out of money by November. And yeah, the federal government could give them more money to keep them afloat, but they can't keep everything afloat. We do not have the resources for that kind of stuff.
Right, because it's not like the government could maybe tax rich people at a higher rate and stop giving them tax breaks and use that money to pay for the stuff that we need. That's just silly.
Not to mention, more people would think that they were entitled to health care, and they would probably overwhelm the hospitals even quicker.
We also could have had less of a burden if we'd been giving everyone access to affordable health care before this pandemic.
Then there are people saying that the eventual vaccine should be free. Alright, well, someone is going to need to pay for the raw materials, someone's going to need to pay for its production, and of course, I suppose you're going to say that the heroes trying to create one don't deserve a damn dime for their efforts. Economics 101 is about supply and demand, which people, by and large, don't seem to understand anymore.
It's like, yes, and we definitely don't have the opposite problem here, where people are going into debt because they had to get a medical treatment that they couldn't afford, or who are going through their life in total pain and agony because they refuse to get treatment for a problem out of fear of going into debt.
Countries with more universal health care are having a ton of problems. That isn't a magic bullet that would have made this all okay. We do not live in a utopia. Thank you for finally noticing. And looking for the utopian option is the fastest way of getting people hurt and killed.
Hey, you just heard it, folks. According to MrEnter, trying to change a broken system that has massive problems is the fastest way of getting people either hurt or killed. I mean, that's exactly what you just said. Hey, you're arguing that we shouldn't try and change the system that we have because the problems the change might create might be worse than the problems that we have now. So why should we even try?
Healthcare is not a human right, at least not in the same way that speech is. No matter what, someone cannot magically produce me a vaccine and cure me if I fall ill. Unlike speech, which is always available to me. No one gives me speech. No one gives me the right to defend myself.
Okay, if you somehow haven't figured it out by this point in the video, I believe healthcare is a human right. I believe it's unethical to have a system which forces people to choose between going into debt or dying. And they shouldn't have to be afraid of leaving a crappy, low-paying job that they're not happy with due to the risk of losing their health insurance. And guess what, Enter? You might be shocked by this, since you clearly never left your house to get a dose of reality before this pandemic, but people don't choose to get sick. People don't choose to have pre-existing conditions. People don't choose to be born with a heart defect or with mental health issues. Why should people be forced to go into debt that they may never be able to pay off because shit happened and they got cancer? Why should a person have to refuse treatment for something like an infected tooth or a broken bone because they can't afford it or don't have a health care plan that covers it?
That's why these are rights. In order to prevent myself from dying, someone has to provide me with a service. And I believe that if somebody prevents me from dying, they should be compensated for that service. And don't say that public taxes are something they could pay for it.
So you have to be deliberately not understanding how government-funded healthcare works. Like, I refuse to believe that you're this stupid. So when your house is on fire and the fire department comes and puts it out, they're also providing a service. You know what? I think I need someone to confirm some of this for me. Hey, Lurks.
Hey, Lurks here. When I'm not dressed up as a fuzzy animal, I am a firefighter. That's right, I work for a taxpayer-funded government agency that provides firefighting, search and rescue services. Most fire departments are like this. In fact, almost all of them are funded by taxpayer money at the state, county, municipal, or federal level. You know, if your house catches on fire, once we put it out, we don't leave you with a bill because we all pay for those services with our tax dollars.
And that was fellow furry YouTuber and real-life firefighter Lurks, everybody. Go check out he and Riven's channel if you haven't already. So if public services like the fire department can work that way through taxpayer funding, why can't healthcare work the same way?
That's exactly how insurance works, pooling everyone's money to pay for treatment, and it works so well!
Really? Okay. Here's a crazy idea. If it works so well, why can't it work on a national scale with one health insurance that everybody pays into through taxes that covers everyone and everything?
And to talk about other people's politics...
Oh, you're just going to pull a Todd Howard and say it just works. And I'm not kidding. He literally doesn't even think of that response that I just gave.
People are saying that capitalism can't stand up to a situation like this, and that means that capitalism is bad. That's a terrible argument. That's the worst anti-capitalist argument that I've ever heard.
Oh my god, you literally just spent most of the video listing problems that have existed under capitalism for years. Suicide due to unemployment and unstable income, that was present before COVID. People not seeking mental health due to not being able to afford it, that was present under capitalism too. Prison overcrowding due to for-profit prisons being incentivized to lock up more people, that's a major consequence of capitalism. Literally everything you have been blaming this virus for has been present under capitalism before this pandemic started. And it's only been amplified by the pandemic.
An economic issue of this scale will cause massive civil unrest, and may even spark civil wars. So please, have a little understanding when people begin saying, this isn't fucking worth it, I'm going outside. Yes, it's very possible that I will get sick. It's very possible that most will get sick.
It's also very possible you'll spread it to other people like essential employees who are surfacing your selfish ass. So you're okay with potentially giving it to them, possibly putting them at risk of death or permanent lung damage, and giving them long-term health complications as a result of your selfish carelessness. Do I have that about right?
And the countries that didn't lock down or relied on herd immunity may be better off in the long run.
Oh no, guys. Oh, look at how many cases of COVID Sweden has. Wow, that's a lot. I guess he's right. I guess universal health care isn't effective, and privatized health care that we have in America works so well.
The disease itself is not going to be the end of humanity. If you catch it, you are most likely not going to die.
Most likely not going to die doesn't mean you definitely won't. And it also doesn't mean you won't suffer long-term health problems as a result of getting it in the future. Or get it again. It also doesn't mean that later down the line it might be discovered that COVID, much like chickenpox, has a second phase that shows up later in life. With chickenpox, it's shingles, which is very painful, and many people say they would never wish it on their worst enemy. What if COVID gets discovered later to have something like that?
In many cases, it is asymptomatic. And no, that isn't just its incubation period. Some people have COVID and never show symptoms ever, or they show symptoms so mild that it's not worth reporting or caring about.
Guess what? Just because you aren't showing symptoms doesn't mean that can't change. Viruses do mutate and can become even more deadly. A virus can start out relatively harmless with not very many symptoms, but somewhere down the line, people can suddenly start suffering from organ failure. And honestly, and I don't usually compare fictional piece of media to real life, but the popular game Plague Inc. is a surprisingly accurate depiction of how a virus can mutate and spread. Yeah, obviously it's more fast-paced because it's a video game, but yeah, without warning, viruses can just suddenly mutate and become even more deadly. They can develop new symptoms. They can attack new areas of the body. Just because it's not deadly now doesn't mean a new strain or a mutation might not make it more deadly in the future.
If you want to know what else you can do to help your chances, most of the people who do get hospitalized are obese. If that describes you, that'd be something to work on.
You hear that, obese people? Just work on not being obese anymore. If you live in a food desert, can't afford healthier foods, don't have time to cook in between jobs, or have genetic risk factors for obesity, just don't have those health disparities anymore. It's just that easy if you live in a bubble like this idiot does.
One of the more popular measures taken was curfews. Because that'll prevent a pandemic. Because as we all know, the coronavirus is nocturnal. It gets very, very sleepy when the sun rises, and it doesn't infect anyone during the daytime, squeezing all of the people into the smallest window of time possible.
Oh my God. You're right. The virus is not nocturnal, meaning that nightlife people can still get it when they go out to clubs, bars, restaurants, or night shifts at their job. Wait, how does this support your argument?
I mean, I don't have a doctorate in epidemiology, but I can't see how that will help prevent the spread of the virus.
Then maybe you should listen to the people who do.
I've heard people talk about mandatory vaccines in their panic. Well, with the anti-vaxxer movement, I've heard this one come up a lot in recent years, but it's at the forefront now, and it is a terrible idea. To put it bluntly, mandatory vaccines are a human rights abuse, and every dictator in history would love to have something like that.
So, let me get this straight. You're not an anti-vaxxer, but you think mandatory vaccinations are a human rights abuse? I can't. I can't.
But let me put it like this. A government that injected pregnant women with plutonium to see what would happen, that hired a service which unknowingly gave LSD to college students, in an environment where it was legally allowed and encouraged to forcibly sterilize mentally handicapped people up until the 1970s, with a medical apparatus that propagated Tuskegee, in a place where lobotomies were the established science, which had such a great eugenics program that Hitler wrote a love letter to it, does not get the right to mandate something like forced injections.
Okay, that's it. You know what? I wasn't planning on doing a face reveal in this video, and I'm really sorry that I'm getting so mad in this video, but you know what? This is, what he just did is so serious that I'm going to have to change into my human form just to show you how emotional this makes me, okay? All right, there we go. How dare you use those cases to argue against vaccination? And don't you dare claim that that's not what you're doing. Those cases are not comparable to mandatory vaccinations, and you know it. Those cases were unethical scientific experiments that yielded no useful results that could be practically used anywhere. And they were a violation of the Hippocratic Oath, and the people involved were all discredited, and it's taught in medical school as one of the biggest blunders in the history of 20th century medicine. And when people advocate for mandatory vaccinations, they don't literally mean, oh, every single person needs to be forced to get vaccinated. Obviously, there are people who are immunocompromised and can't be vaccinated because it's a risk to their health. But if there's an order that gets nearly everybody vaccinated, well, measles wouldn't have made a comeback, would they? I'm sorry I'm getting so angry in this video. I don't normally get so, you don't normally see me so angry on this channel, and you also normally don't see my face. It's like, and you also normally don't see me outside of my werewolf form, but I needed you to see like how angry this makes me and how serious I take this, because like I said, I have a degree in public health, and in public health, they teach you about those cases that he just mentioned. And they are, I honestly encourage you to go out and actually read about them, because they're horrifying and they're fascinating. Especially the Tuskegee experiments. They're so enraging. But none of those are comparable to something like a mandatory order to get more people vaccinated. And the fact that he would use these as examples of something like that is disgustingly irresponsible.
I'm sorry, but when the people at the top on this crisis, like Dr. Fauci, are recommending things like immunity cards, it proves counterintuitive and makes me want to not take any of this seriously, because it makes the cure far worse than disease.
So now you're just parroting Trump. The cure is far worse than the disease. So, honest question here, how many people dying is an acceptable number in order to open the economy back up for you? Would you like to answer that for me?
Have recently taken to saying that the government here in the US should have taken more precautions earlier. They should have done all those lockdown stuffs in February. Right, because that would have gone over beautifully. You know, considering the World Health Organization didn't declare it a pandemic until the middle of March.
Right, and it's not like the World Health Organization saw COVID cases appearing in January and requested to test more, but Trump told them not to. But sure, you clearly know what you're talking about.
An unpopular administration restricting travel around the world, demanding everyone to stay in their houses when the WHO said that person-to-person transmission didn't happen, and the media saying that it was just the flu, all while decrying that the current China travel ban was racist. After all, the WHO condemned travel restrictions, stating that they were unnecessary, and now people are angry that the US defunded them. The WHO has been wrong every step of the way on this. From their bullshit about saying person-to-person transmission was unlikely to happen, to their BS statement on masks. Oh, what's that, WHO? Cats and dogs cannot transmit the disease? Okay. Oh, wait, what's that? Only cats can? Oh, no, wait, cats and dogs both can.
Huh. You know, it's almost like this is a new disease, and we don't know that much about it. And health organizations are learning more and more troubling new information about it every day. Huh. Yeah. Okay, well, you've seen enough of my human form, and we're almost done, thankfully. And so I'm going to change back into what you like to see. So, this has to be one of the biggest self-owns I have ever seen in my life. And I'm so glad that this is what he decided to end the video on, this next part coming up. Because I feel like it absolutely discredits everything that he's said this entire video, because it perfectly shows how little he knows about epidemiology or just science in general. So, just listen.
People scare me more than any disease pandemic could. A virus is rational. What it does makes sense. You can predict it, and honestly, nature itself encourages the virus to be better. The less deadly that COVID becomes through mutation, the better it is for COVID's own survival. Killing people is counterintuitive for the virus's survival. For the same reason, blowing up your own house is counterintuitive to your own survival. This is how many pandemics snuff themselves out. Nature does the work for us. The less deadly the virus is, the better it is for the virus. It's natural selection and work.
Where do I even begin? First off, no. You cannot predict a virus. You literally, just a few seconds ago, argued that the World Health Organization couldn't and were giving out inconsistent information. No, a virus is not rational. It doesn't think, it doesn't feel, it's not an animal. Its only intention is to multiply, attack whatever part of the body that it's designed to attack, and cause as much damage to the host as possible. It literally attacks the body. And that is not how natural selection works, you moron. I'm sorry I'm getting so angry right now, but I just get so angry when I hear ignorant people try and act like they know about this stuff when they don't. That is not how natural selection works. It's not. It's like natural selection is, oh my God, you know what, I don't have time. I want to get through this. If you want to actually know how natural selection works, go look it up. There's tons of articles explaining it if you didn't learn it in school to begin with. But going back to that, if viruses are supposed to become less deadly because that's what's better for the virus, is that why HIV and AIDS are less fatal now than they were in the 1980s? No. It's because medical professionals have actually developed effective treatments for them, such as PrEP. So people who are HIV positive can actually live a normal and longer life with the right continued treatment than they could in the 80s and 90s. There's even treatments that keep it from spreading the disease to their loved ones or children. It's amazing what trained medical professionals can do when they're allowed to do what their job is, right? Like, maybe we should listen to them and not grifters on YouTube like you. Look, Enter, if I could stop dunking on you for a second and offer you some professional advice, I'm not saying you can't have an opinion about this stuff. You have your right to have your opinion. But I draw the line at the point when you're peddling misinformation to people, especially about topics like this that could put their lives at risk if they take you seriously. And Enter, I get it. People like you feel like you're so much smarter and more rational than the trained health professionals with your Ben Shapiro facts don't care about your feelings reason logic. But when you have a guy in an animal suit with a degree in public health lecturing you about this, well, maybe just stick to talking about cartoons. So that was my video, guys. I know I got really angry in this. I really just couldn't help it. I get so angry when I keep seeing this, when I keep seeing misinformation like this related to the virus, because this is playing with people's lives. This kind of information gets people seriously hurt and killed. We live in a new age where a lot of people seem more willing to listen to ignorant losers on YouTube like MrEnter than actual credited professionals. This is why more and more people aren't vaccinating their kids. This is why there are still some people that believe climate change isn't real. Hell, this is why the flat earth myth has made a comeback. Anti-intellectualism and science denial is terrifyingly powerful and effective. And it's able to reach wide audiences such as Enter's almost 300,000 subscribers thanks to the internet. I honestly really hope that my video has given you more information about this virus. Do not listen to people like MrEnter, please. If you're unsure about the virus or have questions about the quarantine or anything else related to the pandemic, ask and listen to medical professionals. They know how this kind of thing works. Before I go, I wanted to give a quick thank you to Lurks for doing that cameo for me. And I also wanted to say that I've included sources for a lot of the stuff that I talked about in this video in the description. If you want to read any more information about COVID or any of the subtopics that I talked about in conjunction with COVID, please take a look in the description. Please subscribe, like this video, and honestly, share this video. Like I said, I've been seeing a lot of misinformation online, and this is just my attempt to counteract that, but at the same time, I'm a very small YouTuber just starting out with just a little over 100 subscribers. So if you could share this on social media with your friends, that would honestly be really helpful because I worked really hard on this response video. But that's all we have time for. Thank you guys so much for watching. Always wear a wolf responsibly, and I will see you in my next video.